Last month, 5-year-old Porter Nixon spent 7 days inside the Alberta Children's Hospital's ICU. Weeks earlier, the Calgary kindergarten student had been infected with COVID-19. But with symptoms no different than the common cold, he was never tested. A month later, he became sick again, this time with flu-like symptoms, then a rash. He was eventually admitted to hospital, diagnosed with multi-system inflammatory syndrome in children, a post-COVID condition also known as MIS-C.
We've seen quite a large number of cases, maybe last 2 months. Almost every day we have a child with MIS-C in the ICU, and often we have a child with COVID pneumonia as well.
Children typically become ill with MIS-C 4 weeks after COVID infection. So it makes sense that weeks after the province saw cases of COVID-19 surge during its fourth wave, pediatric ICUs would be seeing more children sick with MIS-C. According to Alberta Health, there have been 61 cases of MIS-C in the province since the pandemic began, with 27 children admitted to intensive care. This 6-year-old Southern Alberta boy, whose parents have asked that we don't share his name, was admitted to ICU in October as well. His mother says her son had no symptoms of COVID-19, but an antibody test revealed he had been infected with the virus. Weeks later, inflammation in his heart was causing his blood pressure to drop dangerously low.
I don't think people realise that there is a real chance your child can get sick from COVID, and it's certainly, I don't think, widely appreciated.
Which may be why Alberta's Premier says many parents are not planning to get their children the COVID-19 vaccine.
We've done some public opinion research indicating that roughly half of parents of children in that age range are likely to get their kids vaccinated. So it's a much lower level of support.
Both Alberta boys have been released from hospital and are now recovering at home. While there have been no deaths related to MIS-C in Canada, there have been dozens of children hospitalized across the country. And in the U.S., 48 kids have died, a rare but serious risk to children related to COVID-19. Heather, Yourex-West, Global News, Calgary.